My name is Priscilla Ann Spence, and I live in Wayne County, West Virginia. I was diagnosed with psoriatic arthritis in my early 30s, and at the time I didn't have any insurance. I couldn't afford the medications. The Enbrel injections were the best option for me. It's a biologic to fight the progression of the arthritis. He told me I would be in a wheelchair by the time I was 40 if I didn't do something. Then, when I was approved for Medicaid, and it was $1,500 for 4 shots through Medicaid, then I got a job with the state, and the PEIA insurance that I had, they charged over $5,000 for the medication. And I had PEIA as my primary insurance and Medicaid as my secondary. And they still wanted $100 for a copay a month for the Enbrel injections. Then I had to go off the Enbrel injections for a year due to some surgeries, and went back on them and they didn't work. So we had to try something else. I went on Taltz injections, and turns out that they cost $13,000 each. And I had 2 of those injections. The insurance company contacted me and said that they were not going to pay for it because the doctor had not gotten a prior authorization. So they expected me to pay for those injections out of pocket. And $26,000 is more than I grossed in an entire year. Turns out that they didn't need a prior authorization for those injections, so it was paid for. But then I had to go on a different medication, Xeljanz, and I have to take another medication, leflunomide, to go with that. It took 4 months to get that approved through the pharmaceutical company and my insurance to be able to take that. So I was 4 months without any arthritis medication at all, which caused damage to my body and excruciating pain. My doctor took me off work for medical leave, and I eventually lost my job. They kept telling me I was having bronchitis because I developed a really bad cough that I couldn't get rid of. Turns out I was having an allergic reaction to the medication. They pinpointed it to the day that I increased the medication. The insurance company denied a CT scan of my throat because they didn't feel it was medically necessary. So the doctor figured out to do an x-ray while I was huffing, and figured out that I had an angioedema from the medication. And it took me almost 6 months to get the medication out of my system. And now I have allergic reactions to different medications that can cause angioedema. I had to change my blood pressure medication because then it caused an angioedema. Well, I don't think insurance companies should be able to determine what's medically necessary for a person and overrule their doctors who know more about them than the insurance company does. I have very complex medical issues, and only my doctors know what I'm going through.